Welcome to The Planet Forward with Preetha. Conversations for a greener future. The place where we ignite discussions and uncover innovations driving us towards sustainability. Every episode, join your host Preetha as we explore the stories, ideas, and pioneers making a real difference in our world. Get ready to be inspired, learn, and be a part of the change that propels us forward to a greener tomorrow.
Sure. Dr. Kumar, could you describe some of the community health initiatives you've been involved with, especially those that integrate mental health services within broader health systems?
I have been involved in community mental health activities for a long time. But after I have come to Chennai, I have been working at the primary care clinics in the community with people so that mental health care is delivered close to where they live. This is done with an intention of reducing the treatment gap and working towards reduction in number of people who are likely to become homeless, because much of the treatment gap is due to ignorance. Then they may not be able to afford the services, may not be user friendly, the services are far away from them, and lastly, the person concerned may not be willing to come and take treatment. So, the closer you go, the better it is for them to take treatment. See, even though you are closer to them, some of the people may avoid taking treatment because of stigma and discrimination. So this is a challenge that exists all over the world, particularly more in India. So we work to educate them, educate their families, work with their families so that we are able to increase awareness and tell them the positive benefits of taking treatment. And this is likely to increase the number of people who are using our services. In one particular geographical area of 1.5 lakhs population, in the area that we work, the number of people with severe mental disorders that was covered was close to 92%, using Nalam as the person who is likely to raise awareness and bring them to treatment. This is by far the largest recorded number of cases. Of these, a proportion of receive outpatient care, a proportion receive inpatient care for a brief period of time. The rest of them may receive family care, or they may even receive care at home continuously since they have difficulties.
I understand. Oh, that's phenomenal, the work you've done. So with with connection to the same question, so as an advisor to the government of India on mental health policies, what are some key changes you have advocated for, and what impact have these had on mental health services at the community level?
Right. I was part of the National Mental Health Program while I worked in the National Institute of Mental Health Neuroscience, Bangalore. When I was the national coordinator for mental health care, as part of this particular role, meetings were organized to understand the mental health situation, understand the difficulties that exist in mental health, understand the ways forward to increase mental health coverage. And therefore, one that came out of is the improvement that was attempted in 43 mental hospitals. So at that time, 30 mental hospitals existing in the country out of the 43 were considered for what is called as centers of excellence. So additional investment was made, and therefore these hospitals were changed from mental hospitals to teaching facilities. As a result,
Wonderful.
the quality of services improved, the quality of care improved, the quality of involvement improved, and therefore the patient satisfaction also improved. In addition, it started delivering the goal of increasing the number of postgraduates in psychiatry, psychology, social work, nurses, so that the human resource also was simultaneously increased. The second part of it is the decentralized mental health care program that is envisaged in the country from 1985. So
Okay.
this was done with three important objectives. One, to provide mental health care for all in the near future. Two is to involve all concerned and provide them mental health skills training. Third one is to increase community participation. While we have done that, the coverage was slowly increased. Today, we have about 840 districts with mental health program in the country, and these are providing services for people closer to where they are. Though we would desire the primary healthcare personnel to deliver, because that is the closest point at which the services can impact people. Now, if we are able to provide these services closer to where they are, we can reduce the treatment gap from the existing 80% or so to about 50% or 40%, so that we impact three areas of work. One is the disease burden on the family, reduce disability, increase participation, so that the quality of life of these individuals increase.
It's phenomenal work, sir, especially how much you've impacted at a national level, and what you rightfully said. Bringing it back closer to the primary care will definitely improve the numbers, especially from offering healthcare services, especially mental health care services for people. So I think the next question I have is like perfect segue into that. So you worked in mental health during times of disaster.
Yeah.
Could you share how these experiences have shaped your approach to mental health care in crisis situations?
Right. From the time I, as part of a team from the National Institute of Mental Health, started working with the disaster, we had to learn from our presence in the field, learn from hands-on experience from the field, and develop four types of interventions. One is the intervention for the individual, so that he is able to read and understand. In the context of disaster, what happens to me? Why am I fearful? Why am I anxious? Why am I sleepless? Why am I restless? Why am I not able to do things that I was expected to do? Okay, that is the individual level interventions. So the individual level interventions helped him to understand the reactions and therefore seek appropriate help, be it medicines, be it counseling, be it relaxation, be it meditation, or whatever. Then comes the intervention for the school children, where disaster affects a significant number of children, and therefore they may also be feeling confused as to why I am having all these things, why I have become silent, why I am not able to talk to
people,
my other friends in the school. Why am I feeling afraid of going to school? Why I am afraid of leaving home? why I don't want to be away from parents, why am I clinging to these my parents or other significant adults in my family. And this may result in normalizing those reactions, and soon they may go back to school, so that the teacher also is involved in providing this kind of support for the children, so that they will be in a position to recover, understand these reactions, and go back to school, and eventually normalization. If this aspect is not touched upon, the hurt, the trauma remains the same, and that will result in more complications as they grow along. And the silence between the parents who are afraid to talk to them, teachers who are afraid to talk to them, thinking that I will exacerbate these reactions, may actually complicate the whole thing rather than reducing the distress.
I totally
The
understand.
third one is for the family as a whole. So, interventions about what can be done at the family level. How often do they talk about this? What do they do as a family? Group activities, so that there is support available for each other. And the fourth one is about the doctor's manual, so that the doctor is able to understand different reactions and provide them the appropriate support. Similarly, it is the health workers. So these are the 5 stages, 4 to 5 stages, at which we have organized care so that people receive care. Remember, before that, there was no structured inputs that happened in the field. People did whatever they thought was right, and therefore compassion was the key point. And compassion alone may not be necessary. You need to link them to what is called as the umbrella of care, which includes medical care, social care, legal aid, support for housing, and support for the lost documents that must have happened in the context of a disaster or flood or earthquake or something like that, or fire accident for that example, for the matter. People seeking help from the government, uh, the documents can become a barrier, and therefore it is important for the system of governance to see that these are provided as early as possible, and therefore they will be in a position to access the social welfare benefits, or else the proportion of difficulties that they experience will increase, and the difficulties encountered following post disaster itself will become a double trauma, increasing the incidence of depression, suicidal attempts, alcohol and substance use, and so on and so forth.
Understood. That is very insightful for you to say that. So then I want to specifically focus on a question which is directly related to Banyan. So, what innovative models for community based mental care have you helped develop at the Banyan, and what results have these models shown?
So, the innovations that we have done are many.
Okay.
One of them is the NALM approach to deliver primary health care. So, NALM approach involves a NALM worker who has completed about 12 years of education, is trained so that she works in the field. She approaches the distress by trying to mitigate the distress that exists in the family or in the community by linking them to various support systems that exist. For example, the local governance, the local medical system, the local housing system, and so on. So, by providing support for these people, she is in fact saying, hey, I am here to help you. You can talk to me about your difficulties, your
So is it
problems.
like a one-on-one basis? Is it like a one-on-one basis, Mr. Kishore, that they go and actually this one person from Nalam will go and speak with the distressed on a one-on-one basis? Basically,
Yeah, one-on-one basis.
Okay, got
And
it.
it is in the context of the family, so that the mitigation process is transparent to the family, and it remains a kind of a closed secret within the four walls of the family. And from there onwards, rapport is built to understand other distressing mental health problems that may exist. For example, alcoholism, severe mental disorders, undiagnosed depression, or severe familial conflicts, marital conflicts, and so on and so forth. This has resulted in a very high tapping of mental morbidity in the community, because
Okay.
this is a non stigmatizing approach. And this has resulted in very high coverage of mental health services. This also has led us to understand how many people may require care at home. Hitherto, we had considered you come to me, I give you services, whereas following the Nalam approach, we have been able to understand that care in the communities is also necessary, and we have to do it proactively. Though there existed similar models in the country from 1980 onwards to demonstrate the effectiveness of home care, family care, to be cost effective in comparison to the outpatient care. The next innovation is the emergency care recovery centers that we have innovated, we have developed. It came out of a mere action to social distress that existed in the community. This resulted in bringing them to a particular place, sit with them, work with them, talk to them, help them, then understand their difficulties and provide intervention, which ultimately was named the Emergency Care Recovery Center. The Emergency Care Recovery Center is a unique acute care facility where trust, friendship, mutual support, understanding becomes the key aspect of
That's phenomenal.
engagement, and that will, in addition to the medication, helps people recover faster. They are able to develop trust because they lived without trust for years
Years.
and months. And therefore, providing this is a very unique way of establishing a path for recovery for them. And the next one is to understand what is to be done with the backlog of people who are either not able to go home, or who do not want to go home,
Okay.
or family members do not want them, or the family members could not be traced. In such a situation, we brought in about 14 years ago an innovative approach for the first time in Southeast Asia region, perhaps globally also, what is called as home again.
Home again. Wow.
Home again involved for people who are stuck in this context to hire a house, appoint a personal assistant or a healthcare worker, bring in 5 people who have consented to stay in the home again context, and work with them, live with them, so that a recovery process automatically is set in the context of the home, in almost mimicking a very natural situation. So the healthcare worker may become daughter, may become aunt, may become sister, and so on and so forth. So the entire uh, bond of friendship, planning, again is therefore an approach to find long term solutions for people who could stay at home, preventing them from becoming homeless, and help them find their own individual freedom, work, and do whatever they want using the money that they earn. It also helps to increase socialization in the community. Mental illness and post mental illness episode and integration into the community, the most important barrier that exists is stigma discrimination. And we have found home again completely takes that away because it increases social insertion, it increases social participation, it increases work opportunities in the community. As a consequence, they enjoy a very good quality of life.
So, the home again is a very unique concept that I have never heard anywhere in the past. So, you're basically giving opportunity to these people who are in distress mode to come out of it in a much more friendlier atmosphere rather than keeping them in a hospital and they feel that they are alienated. So I think this is a very, very unique way of treating them, especially through Banyan.
Absolutely.
It's very, very unique.
The uniqueness of home again as an approach in comparison to prolonged hospitalization is prolonged hospitalization does not serve any purpose beyond a point. So the individual's ability to learn skills, participate, grow as a human being, and enjoy a good quality of life does not happen in the hospital, and therefore you require freedom, then access to their own rights, their independence, so that they are in a position to move forward and enjoy a good quality of life. In a way, home again guarantees that. Home again also is a single unique intervention which addresses stigma straight away. It shows the community, hey, people with mental health problems can live independently in the community. They can earn, manage their lives. So therefore, it is a kind of a holistic approach to provide stay housing, provide continuous treatment, make them participate in all societal activities, at the same time enjoy a good quality of life.
That's wonderful. So the next question I have for you is, looking ahead, what are your long-term goals for enhancing mental health care in India, and what steps do you believe are necessary to achieve those goals?
So looking forward, our Banyan's vision is to see that everyone has access to mental health care. Rich or poor, north or south, east or west, man or woman, children, elderly, everyone gets access to care as early as possible. Secondly, a large number of people with mental disabilities do not receive any support from the government, and therefore facilitating them to receive welfare benefits is an important aspect that we have worked. We have demonstrated that contributing a small amount of money to them increases their self esteem, reduces stigma, increases acceptance in the family, and now this is slowly becoming a norm across the country, including the state where we have been working. This is a very important development that we are aspiring for. Third one is there are large number of homeless people, and these homeless people should be addressed in a particular way, and therefore the innovation of ECRC is one such step in the right direction, so that trust is developed, there is a sense of friendship, bondage, freedom to explore the environment. In addition to that, medication can help them recover And this is a wonderful model. This is completely different from what is called the acute care that happens in the hospital. Even though this is focused on acute care, environmental change in the ecosystem within the ECRC is going to be very, very important, and ECRC facilitates that. And the next one is a large number of people, after they have been discharged from the hospital, may not have a home to go back to. And home again is one such concept where they can live life with dignity. They have they have the skills that is necessary to manage their own life, and they can live life with certainty. If you hire a house, then the owner will say you have to vacate it. You are not paying rent, you have to vacate it. Whereas home again as a concept makes their life guaranteed to some extent, and therefore they can move on. The
So from a
last
rehabilitation standpoint,
last aspect is to reduce the mental hospital load that is existing. As long as mental hospitals are there, they will have a fixed number of people. Their quality of life will continue to be less, and therefore, by home again approach, we can improve all of those domains.
wonderful.
This is our broader vision for mental health in our country. Ultimately, we want to see every homeless person in this country receives some or the other care.
It's a very brilliant and what a wonderful goal to have, to ensure that everybody, irrespective of. So the last question I have for you, Dr. Kishore, is throughout your distinguished career in mental health, what have been some of the most rewarding experiences, and what advice would you give to upcoming professionals in this field?
Yeah. So thank you for that question, Preetha. Wonderful question. The advice that I have, the information that I have to younger mental health professionals in India is that there are large number of people who are deprived of mental health care in the country, and therefore we should find innovative methods to reach them. We will have to emphasize that mental care has to occur at the level of community clinics as well as home. This would enable people to access care and reduce the treatment gap. Much of these people have to be educated about the social welfare benefits, which is not happening right now. And it is our responsibility to see that this happens. We will have to be proactive as well as work with the government to ensure you will have to take responsibility for people's mental health, and a wide degree of preventive actions has to be taken at the level of the school, the college, the community, children who are outside school, so that much of this work can result in reduction of mental health problem, learning better coping strategies, result in reduction of substance use, better adjustment, and therefore ultimately the overall wellness at all levels for people in the community.
Wonderful. It's a brilliant answer. Thank you so much, sir. So we've come to the end of this interview. So as we come to the end of today's enlightening conversation, I want to express my deepest gratitude to Dr. K.V. Kishore Kumar for sharing his profound insights and experiences with us. Dr. Kumar, your dedication to advancing mental health care and community well-being is truly inspiring, and your efforts are making a significant difference in the lives of many. So, as before we sign off, do you have any final thoughts that you would like to share with us, Dr. Kishore?
So final thought is mental health is everyone's right. If we sit in our offices, mental health care will not happen. We will have to reach out to people, and whatever it may take, work with the people, work with families, work with larger societies to enable mental health care, and you can ensure a happy society around you and in the larger context of your country.
That's so profound and beautiful, sir. Thank you so much. So, to our listeners, thank you for joining us on Planet Forward with Preetha, Conversations for a Greener Future. We hope that today's episode has enriched your understanding of mental health challenges and the transformative power of community centric approaches. Please stay tuned for more episodes that explore the journeys of those who lead, inspire, and make a difference in our world. Don't forget to follow or subscribe to our podcast on your favorite platform. Until next time, keep pushing forward, stay compassionate, and continue to support mental health initiatives in your community. Goodbye and take care.
Namaskar.
Thank you for tuning in to the Planet Forward with Preetha, Conversations for a Greener Future. Together, we're exploring the innovations and stories that inspire us to think and act for a sustainable world. If you're inspired by today's conversation and want to be part of this journey toward a greener future, make sure to subscribe to our podcast on your favorite platform. By subscribing, you'll never miss an episode filled with groundbreaking ideas and actionable solutions. Let's continue to make a difference, one episode at a time. I'm Preetha, reminding you to make every day count for our planet. Until next time, keep moving the planet forward.